Supported self-management. How to manage erectile dysfunction. This video will talk about the management and causes of erectile dysfunction that you may experience after treatment for prostate cancer. What is erectile dysfunction? Erectile dysfunction, or impotence, is when you're unable to achieve or maintain an erection that's sufficient for sexual intercourse or sexual activity. It's caused when nerve signals from the brain are interfered with, affecting the blood supply or desire for sex, libido, making it difficult to get or keep an erection. Other factors associated with erectile dysfunction include arousal problems, inability to orgasm, inability to ejaculate, painful ejaculation, change in penis size. Early treatment of erectile dysfunction will help limit and prevent some of these symptoms. What causes erectile problems? Some treatments for prostate cancer can damage the nerves and blood vessels that are needed for an erection. However, not everyone will experience problems with erectile dysfunction following treatment. The prostate cancer treatments include radical surgery, brachytherapy, radiotherapy, hormonal therapy, high-intensity focused ultrasound, and cryotherapy. It's the treatment for prostate cancer that causes the problems, not the disease itself. Erectile dysfunction is a symptom, not a disease. Factors affecting erectile dysfunction: damage to the cavernous nerve and blood vessels, psychological consequences, pre-existing erectile dysfunction. Other health issues can also cause erection problems. These include hypertension, high cholesterol, diabetes, heart problems, hormonal problems, prostate conditions, neurological conditions such as epilepsy, stroke, multiple sclerosis, or Parkinson's disease, certain medications and lifestyles, depression or anxiety, spinal problems, renal transplant and dialysis. Treatment for erectile problems. There are several different treatment options available, which work in different ways. Tablets or oral medication, such as sildenafil, Viagra, tadalafil, Cialis, Avanafil, Spedra, or Vandanafil, Levitra. Vacuum pump, penile injections, urethral pellets or creams, psychosexual therapy, penile implant, self-help. Erectile dysfunction may be helped by making lifestyle changes which reduce the risk factors, keeping a healthy weight, stopping smoking, exercising regularly, reducing alcohol intake, and doing pelvic floor exercises may help improve erections. It can be difficult talking about sex, but talking to your healthcare team will help you get the treatment and support you and your partner need. You can also access more information via the link on your screen. Further support. If you'd like to discuss aspects of the video or have any concerns, please contact your healthcare team. Useful links can also be found in your handbook. Prostate Cancer UK offer a sexual support service to support you and your partner with any questions you may have. Thank you.